Place and hold exercise for flexor tendon repair. Secure the dorsal blocking or tenodesis orthosis with a metacarpophalangeal joint flex. Possibly place the IP joint into flexion. Instruct the patient to contract lightly and hold for 5 minutes, then relax. Perform 10 repetitions, 3 to 5 times daily. Ensure the patient maintains finger flexion while the wrist is extended, then allow the wrist to flex as the digits extend. Begin practice on the uninjured hand before progressing to the repaired hand. Place and hold exercise for extensor tendon repair. Remove the volar blocking orthosis only during exercise. Possibly place the repaired joint in neutral, then into slight extension. Instruct the patient to hold the position for 5 to 10 seconds before relaxing. Perform 10 repetitions, 3 to 5 times daily. Reapply the orthosis immediately after exercise. The primary goal is to prevent extensor lock. Flexor tendon gliding exercise. Position the wrist in neutral. Progress to flexion and extension once cleared. Guide the patient through 6 positions, each held for 2 to 3 seconds. Straight hand. All joints are extended. Hook fist. MP extended, IP flexed. Full fist. All joints flexed. Tabletop or intrinsic plus. MP flexed, IP extended. Straight fist, where the MP and BIP are flexed and DIP are extended. Thumb flexion at MP and IP. Complete 5 repetitions of each position for 3 cycles, 3 to 5 times daily. Flexor tendon blocking exercise. Place the forearm in supination with the hand supported on a table. Stabilize the hand to prevent unwanted motion. Now, we'll be performing the following. First is MP flexion. Second, PIP flexion while maintaining the DIP extension. Lastly is DIP flexion while stabilizing the middle phalanx. Now, smoothly form a full fist, then open fully. Complete 10 repetitions for each pattern, 2 to 3 sets, once or twice daily. Exercise to reduce extensor lock. Begin with the hand in a fist, then open into a hook position to isolate the MP extension. Maintain MP flexion while extending the IPs to isolate the IP and the IP extension. Now perform thermal extension by lifting from a flat palm into end range or slight hyperextension using a pencil or block if needed. Execute 8 to 12 repetitions for each exercise, 2 to 3 sets, once or twice daily. So discontinue or regress exercise if extensor lag increases. Extensor tendon gliding exercise. Passively flex one finger while the remaining digits stay extended. Actively flex one finger while the others remain extended. Now progress to the advanced longhorn pattern by flexing the middle and ring fingers while keeping the index and little fingers extended. Hold each position for 2 to 3 seconds and perform 5 repetitions for each pattern, once or twice daily. Strengthening exercise for weak intrinsic muscle. Instruct the patient to perform MP flexion with IP extension. So from full extension, press into the tabletop position while resisting at the proximal phalanges. Perform intrinsic plus resistance from a band or putty. Add finger abduction and adduction with resistance at the proximal phalanges. Then train the thumb with palmar abduction, position, tip to tip, tip to pad, and pad to side patterns using putty, ball, or cloth spin. Perform 2 to 3 sets of 8 to 12 repetitions, 3 to 4 days per week. Strengthening exercise for weak extrinsic muscle. So for MP extension with forearm pronated, extend fingers over the table edge against light resistance from a band or weight. So in our case, we use a tablet. So now for IP flexion, perform self-resisted curls by pressing finger pads into the opposite hand and flexing through the PIP and DIP joints. So in our case, we use tumbler for curling. Now, maintain the wrist in neutral throughout and then perform 3 sets of 8 repetitions 3 times per week. Strengthening exercise for combined intrinsic and extrinsic muscles. Place the heel of the palm on a towel or newspaper. Instruct the patient to crumple the paper by applying downward pressure with the palm while keeping fingers relaxed. Smooth the paper flat after each round and perform the activity 3 rounds per set, 3 sets of 8 repetitions. Strengthening exercise for combined intrinsic and extrinsic muscles. Place the heel of the palm on a towel or newspaper. Instruct the patient to crumple the paper by applying downward pressure with the palm while keeping fingers relaxed. Smooth the paper flat after each round and perform the activity 3 rounds per set, 3 sets of 8 repetitions.